Hello everyone, this is Dr. Mohsin and today I'm going to discuss how to find the relevant things in SimMan Trolley. This is one of the most common confusion candidates have in exam. So before discussing where you are going to find the relevant thing, first I will want to give you a pro tip. That is, always verbalize the thing that you are going to give to the patient. That is acceptable, more than enough you can say. If you are verbalizing the right thing, that would be acceptable. Suppose if it is morphine toxicity case, just try to search in C part for medicine, and if you are not able to find, just say I am going to give you my patient naloxone 0.4 mg. That is acceptable. Alright. Okay, so now I am going to discuss from where you are going to find the relevant things. So doctors, most of the times stethoscope will be on the top of the trolley. Alright. It might not be there, but most of the time you will find it on top of the trolley, uppermost top of trolley. So next thing, doctors, just follow the ABCD guideline. Means which thing you need in which system, just open that door. Suppose if you are assessing patient's airway and you need oropharyngeal airway, nasopharyngeal airway, you need suction set, tongue depressor, always open the topmost trolley. Alright, you will gonna get those things there. So if you have some unconscious patient, some patient who is choking, definitely you are more concerned about the airway of that patient. So you will be opening the topmost trolley for oropharyngeal airway, nasopharyngeal airway. So this is how oropharyngeal airway looks like. Right? This is oropharyngeal airway. This is how it looks like. Then you can get suction set in the top row as well. Alright. So doctors, airway, open the topmost row. Oropharyngeal airway, nasopharyngeal airway, suction set or tongue depressor. Patient is unconscious or choking. Next thing is Dr. B. That is breathing. In B part, definitely you are examining the patient's chest. Alright, so while examining the chest, what are the things you need? You need this stethoscope. If it is not there on the uppermost surface of the trolley, it will be B in this second row. Alright. Next thing, doctor, while assessing the chest, you might have wheeze. Then you need to give patient salbutamol. That would be again in the B part. You might need to give patient ipratropium. That would be again in B part. Non-rebreather mask, oxygen mask, nasal cannula, ambulance, this all would be in B part, right? So this is how non-rebreather mask looks like. 100% oxygen, 15 liter per minute believers. This is how non-rebreather mask looks like, alright? Definitely venturi mask will be here. This is how venturi mask looks like. This is 24%, 2 liter. Right? There are different colors. It depends upon the color, how much percentage and how much weight, alright? Then ambu bag will be also in this B second row. Alright, what are the things you need? That will be in second row while assessing for chest. Alright, definitely then salbutamol and ipratropium will also be in this row. Next, doctor, now moving towards the C part. Alright, in C part this is circulation part. What are the things you might need? You need IV cannula, you need alcohol swab. To clean the surface, you need fluid, you need blood bottles, you need syringes, you need medicines. Most important thing, medicine. That would be in C part, this third row. Alright. So let me show you two things. Fluids will be there in this row. Syringes will be there in this row. Alright. Blood tubes in this row. Tourniquet will be in this row. Alcohol swabs will be in this row. Alright. So blood products will be in this row. So things you need for circulation, when you notice BP is low, then you're gonna put IV cannula, you're gonna take blood samples, all these things will be in C part, alright? The third most row. Fourth thing is D, fourth row. What are the things you need in D? You need thermometer to check the temperature, you need glucometer to check the blood sugar, you need torch to look into the pupils. All these things will be here. And if in D part you notice patient is having fits, you will find lorazepam like anti-seizure medication in this fourth row, this row. Alright, so let me show you the things. So doctor, you will find glucometer in this. Alright, you will find BP apparatus in this. Alright, and if some trolleys have 5 drawers. If there are 5 drawers, then you will find the thermometer in like the 5th drawer. Otherwise, you gonna, if it is like this, or is 4th 4 drawer trolley, it will be having all these things in this 4 drawer, and that will be having torch in this drawer as well. Alright, so if there is 5th drawer, you will gonna get Foley's catheter. In 5th drawer you gonna get the blood bag, because in exposure while when you are in E part, you gonna putting the Foley's and then attaching with the urine bag. So all these things you gonna find in E part. But if trolley is 4 drawers, then you gonna get Foley's catheter, the blood bag, all these things in D part, along with thermometer, glucometer, torch, everything would be in this part. Alright, and definitely you're gonna find dressings in this part as well. So just quick review now. Topmost surface will be having step. Then A part, what else thing you need in A part? Oropharyngeal, nasopharyngeal would be in A like topmost row. Second row would be having cerebellum, tropium. If steth is not there, it would be in second row. NRB, oxygen mask, everything would be here. Then in third most row, IV cannulas, alcohol swab, IV fluid, blood bottles. You need syringes, medicines would be third row. Fourth row would be having torch, glucometer, strips, the dextrose. If blood sugar is low, definitely gonna give glucose in this D part, then it will be also in this 4th drawer. And the thermometer dressing machine will also be there if it is 4th drawer trolley. So doctor, this is all from how to find relevant things in SimMan Trolley. Thank you so much.